Good afternoon, student. So, in the yesterday's lecture of ophthalmology, we were studying about the tumors of the uveal tract, that is, tumor of the choroid, iris, and ciliary body. Then, our next topic is homeopathic therapeutics for the diseases of the uveal tract. In that, firstly, when there is a choroid inflammation, that is atrophic, so Nux vomica, phosphorus, and pillock is useful. Then for the choroiditis, when it is disseminated and simple, then arsenic album, belladonna, bryonia alba, citron, gelsemium, ipecac, kali iode, murk, murk iodum rubrum, naphthalene, phosphorus, prunus spinosa, santal, tap, tellurinium, and thuja are used. When there is a suppurative choroiditis, then Hipparcel and Rostock can be used. When choroiditis is suppurative with iris involvement, then kali iode, prunus spinosa, and silicea can be used. When choroiditis is suppurative with retinal involvement, that is syphilitic, then aurum med, kali iode, kali murk, and murk iodum rubrum are used. In the iridochoroiditis, kali iode, prunus spinosa, and silicea can be used. Iridocyclitis, traumatic with the infection and sequelae, then nitrum silicata is used. And for the prolapse of the iris, antimicid and physostigma are used. For the iritis, that is inflammation of the iris, remedies used in general are aconite napellus, arsenic album, belladonna, citron, cinar, clematis, DUV, euphrasia, ferrum phos, gelsemium, grindal, pipersal, iodum, calibicromium, caliiodum, mercor, mercsulf, pulsatilla, rustock, spigelia, staphysagrina, symphytum, tellurium, terebinthina, and thuja can be used. When there is a plastic iritis, then equinate napellus, bryonia, Synap, Hipparcel, Mercor, Rostock, and Thuja can be used. And for the rheumatic arthritis, Arnica, Bryonia, Clematis, Colchicum, Euphrasia formica, Calibicromium, Calmia lata, Lidumpal, Mercor, Rostock, Spigelia, Terebinthina, and Thuja are used. For the serous iritis, Apis mellifica, arsenic album, bryonia, citron, gelsemium, mercor, mercurius, spigelia can be used. For the syphilitic iritis, asafoetida, aurum med, synap clematis, iodum, kali beach, alibicromium, kali iodum, mercor, mercinatus, merc iodum flavum, nitric acid, sulfur, and thuja can be used. For the traumatic iritis, aconite napellus, arnica, belladonna, hamamelis, ledum pal, and rustox are useful. For the tuberculous iritis, arsenic album, calibicromium, sulfur, symphytum, tuberculinum are useful, and for the panophthalmitis, heparcel panrostox are indicated. Then the diseases of the ciliary muscles in that firstly, when accommodation is disturbed of ciliary muscles, then ipecac and ruta can be used. And when there is a paratic condition of the ciliary muscle, then argentum nitricum, atropine, causticum, gelsemium, paris, physostigma are indicated. And when there is a spasm of the ciliary muscle, then agaricus, acer, ipecac, jaborandi, lilium teeth, physostigma, and pillock are useful. And when there is a ciliary neuralgia, then arsenic album, citron, clemitis, simicifuga, cinchona officinalis, cinna colchicum, communal crocus sativa, crotonti, gelsemium, lachesis, mesotherium, nitrum mur, paris, phosphorus, platinum, prunus spinosa, rhododendron, sapon, and spigelia are indicated. So, in yesterday's lecture, we was studied briefly about Aconite nepalus, Arsenic album, Belladonna, Bryannia alba, Citron, Euphrasia officinalis, and Gelsemium. So, in the today's lecture, we will start briefly the homeopathic therapeutic for the diseases of the uveal tract. So, firstly, in that heparcel objective is that upper lid are red, swollen, inflamed with pressure pain. There is a morning agglutination and inflamed eyes, white red, profuse lacrimation, and spasmodically closed lid in the morning. Subjectively, the patient feels that there is a intense photophobia, eyes are very painful or aching in the bright daylight. He is attempt to move them. Eyeball very sensitive to touch. Pains are sore as if bitten. There is depressive pain, throbbing pain, shooting pain, and smarting pain. Smarting pain in the external canthus with the hardened mucus and pressure in eyes as from the same. Vision is that there is a obscuration while reading, dim light by the candle light, blindness on rising and standing after sitting, bending over, field of the vision reduced one half, and continual movement of the bright circle before the eyes. So the object looks too large in the hypercell. Characteristics are there is a oversensitiveness of the nervous system. Hence, extreme sensitiveness to touch, to cold air, and to cold application. The sensitiveness makes the subject irritable and with hasty speech and actions. So clinically, Hepar is very useful in the case of blepharitis, keratitis, follicular inflammation of the cornea in the corneal opacities, and suppurative choroiditis, acute phlegmonous inflammation, pustular and ulcerative keratitis with great intensity of symptoms, and deep slugging corneal ulcer with HEP2. So there is a corneal abscess, keratoiritis, catarrhal or purulent conjunctivitis, and Kali Mur. Next remedy is Kali muriatica. So it is recommended for the second in the exudative inflammation of the uveal tract. So it is useful in the exudative stage of the inflammation. Characteristics is indolent inflammation. Discharges are thick, whitish, fibrinous, mucus, dirty white or grey coat at the base of the tongue. Then there is a fibrinous exudation in the interstitial connective tissue and lymphatic enlargement. So there is a suppurative choroiditis with retinal involvement, that is syphilis. So this is all about the Kali mood. Then the next remedy is mercurius. Objective is that upper lid is thick and red, like a star, and eyes are inflamed with the swollen tarsi and very sensitive to touch or light. Lids are spasmodically closed. There is a acrid lacrimation and morning agglutination. So eyes forcibly drawn together. There is an inflamed swelling in the region of the lacrimal vein. Subjectively, photophobia, gaslight, intolerance of light and firelight. So there is a heat, redness, pressure in the eyes with the burning and biting. There is a sensation of a cutting substance under the left upper lid with choroiditis and disseminated and the simple choroiditis. So remember, mercury is useful in the simple and disseminated choroiditis. Vision is a dim, a fog before one or both eyes. Eyes are drawn together or trying to look at anything and cannot see it distinctly. The more she tries, the less able is she to restrain the contraction. She is obliged to lie down and close the eyes. There is a blinded by firelight in the evening. Characteristics is that Mercurius is aggravated at night. There is a discharges are thin, sand acrid by the glare of flare, by the glare of fire. Clinically, syphilis is a marked dacryocystitis, syphilitic lacrimal fistula, eye trouble from working over a fire. There is a ophthalmia neuralgia and superficial inflammation of the cornea or conjunctiva. There is a cataract, follicular or ulcerative conjunctival redness, variable, usually marked. Sometimes it is useful in the case of the chemosis. Keratitis usually form from the hereditary syphilis and keratoiritis, with or without hypoplasm. So there is a episcleritis, blepharitis and iritis. So mercury is useful in the case of the iritis. Then mercurial pains are generally severe and more frequently there is a tearing, burning and shooting or a sticking and not not confined to the eye but into the forehead and temples. Temples often sore to touch. Iritis and retinitis with the suppurative choroiditis and optic neuritis. So, mercury is a deep acting remedy useful for the cases of the diseases of the uveal tract and for the many diseases of the eye as we seen above. Then next remedy is a nux vomica. Objective of nux vomica is that lids are twitch, eyes are blink, movement are difficult on account of the muscular stiffness. There is a lacrimation in the morning while yawning. Eyes are full of water. Subjectively, there is a photophobia. Photophobia in the morning. A smarting, dry feeling in the inner canthi in the morning in bed and biting in the eyes with the external canthi as from with the lacrimation. The canthi are painful as if sore and margins of the lid are painful as if rubbed sore on touch. There is a morning pressure in the upper lid and in the margins. So vision is a cloudy. There is a glittering appearance before the eyes, floating back black and grey points. Vision are very sensitive. Retinal hyperesthesia, glaucoma. Then characteristics of nux vomica is there is a thin, irritable, phlegmatic person with a dark hair. Persons who make a great mental exertion or lead a sedentary life and worse in the morning. So there is a dull frontal headache and atrophic choroiditis. Then next is a phosphorus. Phosphorus objectively the patient shows there is a sunken eyes and which is surrounded with the blue ring. Eyes seem too large. There is edema of the lid and around the eye, ptosis and myopia. Subjectively, there is a aching and burning pain in the eyes with the stiffness and heat. There is a dull pain after reading. Visions are objects look red, letters look red when reading. There is a hemerotopia, day blindness, sees more distinctly in twilight than during the days. Eyes give out while reading, and characteristics are there is a very sensitive to the external impression. Clinically, there is a choroiditis, disseminated and simple type, then choroid inflammation that is atrophic with ciliary neuralgia, blepharitis, keratitis, corneal opacities, myopia due to or increased by the ciliary spasm. So it has been reduced perceptibly with the 2x interval. Phytolacca In that, objectively, lids are inflamed, swollen, hard, reddish blue edematous with the left in the morning. Lids are agglutinated and there is a lacrimation. Subjectively, there is a photophobia, pressure around the eyes in afternoon, and as if they were too large, with the smarting, sandy feeling in the eyes. Lids feel as if granulated, and the edges feel scalded, hot as if raw, dull aching pain in the eyes, motion, light or exercise. There is a aching pain along the lower half of the right orbit. Characteristics are there is a weakness and tired aching and soreness generally all over the body. There is a stony hardness of the bluish inflammation of cellular tissues. Clinically, there is a orbital cellulitis. Lids are hard, swollen, reddish blue without severe pain. Chemosis, more or less dull aching pain, panophthalmitis, suppurative choroiditis, and blepharitis. The next remedy is the Physostic. Follicular conjunctivitis, then staphyloma after suppurative inflammation with increasing myopia, contraction of the pupils, and twitching of the ocular muscles, night blindness, photophobia, glaucoma, flashes of the light. There is a parietal blindness, iridochoroiditis, and the prolapse of the iris. So there is a paresis of accommodation and paresis of ciliary muscles. There is a profuse lacrimation, astigmatism, and the spasm of the ciliary muscles irritability with after using eyes. Post-diphtheric paralysis of the eye and accommodation muscles. There is a next remedy is the Pulsatilla. Pulsatilla is a great deep acting remedy consists of thick, profuse yellow bland discharge. There is itching and burning eyes, profuse lacrimation, and secretion of mucus. Lids are inflamed and agglutinated with the corneal opacity. Type iritis, veins of the fundus oculi greatly enlarged. There is ophthalmia neonatal, blepharitis with the subacute conjunctivitis with dyspepsia. Then it is pulsatilla is worse in a warm room, heat, rich fat food after eating and towards evening. And pulsatilla is better in open air, motion, cold application, cool food and drink. Next remedy is the silicia. Silicia in that angles of the eyes are affected with the swelling of the lacrimal duct. There is a suppurative choroiditis with iritis. Aversion to the daylight, it produces a dazzling sharp pain through eyes. Eyes are tender to touch and worse when closed. So visions are confused, letters run together on reading. Styles, iritis and iridochoroiditis with the pus in the anterior chamber. There is a perforating or slugging ulcer of cornea. Abscesses in the cornea after traumatic injury. Cataract in office workers and blepharitis. After effect of the keratitis, ulcer cornea clearing the opacity. So use 13 potency for a month. That is about silicia. Then the next remedy is the sulfur. Sulfur is a chronic, deep acting antisoric remedy useful in the diseases of the eye when the patient shows objectively lacrimation in the morning with the burning followed by dryness. There is a swelling and pain in the lid with lacrimation. Eyes are dry in room and lacrimation in open air. Lids are red and swollen in the morning. Redness of the lid and conjunctiva. Eruptions of the pimples on upper lid. There is a heaviness of eyes and morning agitation with the nocturnal. Then there is a redness of the eyes during the day with the violent itching in the evening and inflammation of the eyes or lids with the sweat. There is a redness of the conjunctivitis, a white vesicle on the white of the eye close to the cornea. Purulent mucus in the eyes subjectively with the much itching in the eyebrows and tip of the nose of the lid with burning. So in the sulfur there is a dryness of the inner surface of the lid and burning with dryness, smarting pain and itching of the lid margin mostly in the mouth. There is a sandy sticking and burning in the outer canthus with the pricking in the eyes causes one to scratch and rub them. There is a biting of the eyes and lacrimation, very often a feeling of heaviness and aching in the eyeball when reading or writing. Iritis. Characteristics are worse after washing, bathing, early morning. Sulfur owns its laurels chiefly in chronic diseases, but it is none the less important in acute condition or as an intercurrent remedy. It is especially useful for the people subject to skin eruption or after the such a eruption have been suppressed, that is even many years before, by local treatment. So there is a sharp darting pain like a pin pricks. So this is all about the cell. Then next remedy is the delirium. Delirium is also important for the diseases of the uveal tract when there is a choroiditis is disseminated and simple. So in that there is the lids are thickened, inflamed, itching, pterygium, then pustular conjunctivitis, cataract, following ocular lesions, aids the absorption of infiltration in iris and choroid, blepharitis and iritis. So there is a choroiditis when disseminated and simple, then delirium can be useful. Then next remedy is a rust tox, that is rust toxicodendron. It is indicated when there is a swollen red edematous or vital cellulitis, pustular inflammation, photophobia, profuse flow of the pus, edema of the lid, suppurative iritis, lids are inflamed, agglutinated, swollen, there is a glaucoma, old injured eye, then circumscribed corneal injection, intensive ulceration of the cornea, Iritis after exposure to the cold and dampness of rheumatic origin. Eye are painful or turning it on pressing. There is a profuse gush of the hot, scalding tears upon opening the lid. Rostock is the worst in a cold, wet, rainy weather, night and during rest, and it is better in warmth and dry weather. Rostock is useful when there is a corneal inflammation due to the foreign body. In pinacticular keratitis, then staphyloma after suppurative inflammation of the cornea, corneal ulcer, blepharitis, suppurative choroiditis, and iris. Last remedy of these homeopathic therapeutics for the diseases of the uveal tract is that Thuja occidentals. Thuja is useful when there is a nocturnal agglutination and pimples on the lower lid margin. When there is a sty in the right eye and white of the eye is much inflamed. Then, subjectively, there is a tearing pain in left brow, disappear after touch, lids feel swollen as if a foreign body were in the eye. There is a burning and stinging in the edges of the lid, evening, and in the eyes with injection. Eyes feel dry, sandy, pressure in the eyes, and a painful stitch through the center of the left eye. Commencing in center of the brain, there is a choroiditis, which is simple and disseminated, and iritis. So, Thuja is useful in case of the iritis and when there is a disseminated and simple choroiditis. So, this is all about the homeopathic therapeutics for the diseases of the uveal tract. So, the diseases of uveal tract and its homeopathic therapeutic is completed now, and then we will start about the next chapter, that is diseases of the vitreous. The applied anatomy of the vitreous humor is that vitreous humor is an inert, transparent, a jelly-like structure that fills the posterior four-fifths of the cavity of eyeball and about 4 ml in volume. So, when we see a diagram, so this is a gross anatomy of the vitreous. In that we can see the ora serrata, then this is a Vigas ligament, it is a space of the burger, then this is a anterior hyaloid membrane, this is a vitreous space that is 4 mm, then this is a cloaquet's canal, and this one is a posterior hyaloid membrane. So this is a gross anatomy of the vitreous humor. Vitreous humor is a inert, transparent, jelly-like structure that fills posterior four-fifths of the cavity of eyeball and about 4 ml in volume. So it is a hydrophilic gel that mainly serves the optical function. In addition, it mechanically stabilizes the volume of the globe, and it is a pathway for nutrients to reach lens and retina. So, this is a vitreous humor is a pathway for nutrients to reach lens and retina, and mechanically it stabilizes the volume of the globe. So, it is a hydrophilic gel and mainly serve the optical functions. Then, when we see the structure of the vitreous, the normal youthful vitreous gel is composed of a network of randomly oriented collagen fibrils interspersed with numerous spheroidal macromolecules macromolecules of hyaluronic acid. The collapse of this structure with the age or otherwise lead to the conversion of the gel into solution. The vitreous body can be divided into the two parts. That is, first one is the cortex and the nucleus, the main vitreous body. So, when there is a collapse of the vitreous with the age or otherwise lead to the conversion of gel into the solution, the vitreous body can be divided into two parts. First one is the cortex and the nucleus, that is main vitreous body. So when we see the diagram of the gross anatomy of the vitreous, we can see that this is ora serrata, this is a Weger's ligament, space of Berger, anterior hyaloid membrane, posterior hyaloid membrane, Cloquet's canal, and vitreous space, that is 4 mm. The cortical vitreous, that is cortical vitreous, lies adjacent to the retina posteriorly and lens ciliary body and zonus anterior. So remember that diagram. In that we can easily see that cortical vitreous adjacent to the retina, and posteriorly there is a retina, and anteriorly there is a lens and ciliary body with the zulus. The density of the collagen fibrils is greater in this peripheral part, and the condensation of these fibrils form a false anatomic membrane which is called as the anterior hyaloid membrane. Anterior to ora serrata and posterior to the hyaloid membrane which is posterior to the ora. So there is a condensation of these fibrils and form a false anatomic membrane. So there is a anterior hyaloid membrane which is anterior to ora serrata and posterior hyaloid membrane it is posterior to ora. So this is posterior hyaloid membrane and this one is the anterior hyaloid membrane. Then attachment of anterior hyaloid membrane to the posterior lens surface is firm in the young and weak in the elderly, whereas posterior hyaloid membrane remains loosely attached to the internal limiting membrane of retina throughout the life. So remember, there is an attachment of anterior hyaloid membrane to posterior lens surface, and it is firm and the young and weak in the elderly, whereas posterior hyaloid membrane remain loosely attached to the internal limiting membrane of the retina throughout the life. So in that we can see how the anterior highlight membrane it attached to the posterior surface of the lens and posterior highlight membrane is attached to the surface of the retina. Then these membranes cannot be discerned in normal eyes unless the lens has been extracted and posterior vitreous detachment of when we study about the cortical vitreous, these membranes, that posterior and anterior haloid membrane, cannot be discerned in the normal eyes unless the lens has been extracted and posterior vitreous detachment has occurred. Then the main vitreous body, that is nucleus. Nucleus is it it has a less dense fibrillar structure and is a true biological gel. So remember nucleus is a true biological gel and less dense fibrillar structure. It is here where the liquefaction of vitreous gel starts first. Microscopically, the vitreous body is homogeneous but exhibit wavy lines as of water silk in the slit lamp beam. So there is a running down the center of the vitreous body from the optic disc to the posterior pole of the lens is the highlight canal, that is Cloquet's canal of doubtful existence in the adult. So microscopically vitreous body is homogeneous but it exhibits wavy lines as water silk in the slit lamp and running down to the center of the vitreous body from the optic disc to the posterior pole of the lens is the highlight canal, that is Clovet's canal of doubtful existence in us. So down this canal ran the highlight artery of the fetus. Then the attachments are the part of the vitreous about 4 mm across the ora serrata. It is called as the vitreous disc. So vitreous base is part of the vitreous, but 4 mm across the ora serrata, where the attachment of vitreous is strong, and the other film attachment are around the margin of the optic disc, foveal region, and back of the crystalline lens by hyalodocapsular ligament of Wells. So when we see this diagram, this is a vagus ligament where vitreous is strongly attached to the ora serrata. This is a in this there is a vitreous base. Then the next topic is the disorders of the vitreous, that is vitreous liquefaction and synthitis. Vitreous liquefaction, that is synthitis, is the most common degenerative change in the vitreous. Causes of liquefaction include A. That is the degeneration such as the senile, myopic, and that associated with retinitis pigmentosa. Second is the post-inflammatory, particularly following uveitis. Third, that is trauma to the vitreous, which may be mechanical, that is blunt as well as perforated. When there is a thermal effect on vitreous following diathermy, photocoagulation, and cryocoagulation. So, there is a radiation effect may also cause liquefaction. Clinical features of that are on a slit lamp biomicroscopy, the vitreous liquefaction, that is synthiasis, is characterized by absence of normal fine fibrillar structure and visible pocket of liquefaction, and it is associated with the appearance of coarse aggregated material which moves freely in the free vitreous, and liquefaction is usually associated with collapse, syneresis, and opacities in the vitreous, which may be seen subjectively as black flutters in the front of the eye. Then, vitreous detachment. So, there is a first one is a posterior vitreous detachment, that is PVD. PVD, it refers to the separation of cortical vitreous from the retina anywhere posterior to the vitreous base, that is 3 to 4 wide area of the attachment of vitreous to the ora serrata. PVD, that is posterior vitreous detachment with vitreous liquefaction, that is synthiasis, and there is a collapse, that is syneresis, is of the common occurrence in the majority of the normal subject above the age of the 65 years, and it occurs in the eye with the senile liquefaction. There is a developing a hole in the posterior hyalid membrane. The synthetic fluid collects between the posterior hyalid membrane and the internal limiting membrane of the retina and lead to the PVD up to the base along with the collapse of the remaining vitreous chain, that is syneresis. Then these changes occur more frequently in than the phytics, in the myopes than in methods. So when we see the diagram of the posterior vitreous detachment with synthiasis and syneresis, so this is a vitreous syneresis. This is posterior vitreous detachment and this is synthetic fluid. A ring-like opacity, that is Weiss's ring or Fuchs ring, representing a ring of attachment of vitreous to the optic disc and is pathognomic of PVD. So there is a compilation of PVD is PVD, that is posterior vitreous detachment include retinal break, vitreous hemorrhage, retinal hemorrhage, and cystoid maculopathy. Second, that is detachment of vitreous base and anterior vitreous is that it is usually occur following the blunt trauma and it may be associated with vitreous hemorrhage and anterior retinal dialysis and dislocation of crystalline plates. So, this is all about the diseases of the vitreous in that firstly we say about We studied about the applied anatomy of the vitreous, its structure, that is gross anatomy of the vitreous. In that, this is ora serrata, this is the vagus ligament, space of the burger, this is the anterior highlight ligament, this is the posterior highlight ligament, then Cloquet's canal and the vitreous base, that is 4M. Then cortical vitreous, the main vitreous body, that is nucleus and its attachment, and disorder of the vitreous liquefaction, that is synchiasis. Its causes, clinical features, vitreous detachment, that is posterior vitreous detachment, PVD, and its diagram with synchiasis and synergies. In that, this is vitreous syneresis, this is a posterior vitreous detachment, this is a synchytic fluid and its complication, and the detachment of vitreous base and the anterior vitreous, that is second point. So in the next chapter we will continue our lecture of ophthalmology with vitreous opacities. So have a good day student, and today we are stopped here.